Dr. Bojana Yankovic, and we're here today with my dear friend and colleague, Dr. Katie Velesny, who is a dermatologist, and we're going to talk to her about skincare routine. So what's the optimal skincare routine, what everyone should be doing for their morning and nighttime routine, and what you can really do to sort of maintain your skin and kind of give it the best chance of that youthful look. So one of the things that I'm confused about, Katie, every time I go into like a big department store and I'm looking at like different skin products, it's like people are trying to sell me like all sorts of like serums and creams and ointments, and I have no idea, first of all, what the sequence should be. When it's more than 3 things that I have to put on my face, I have no idea what the sequence should be. What do I really need? What's making a difference? Or what's potentially damaging my skin?
Yes.
So if you could demystify this, I'm sure a lot of people would be very grateful, including myself.
Perfect. Okay, I will try, and it's not that simple, but I will try and at least boil down to some sort of more must-haves and things that are helpful for the skin.
Sure.
So first of all, cleansers. I think cleansers always get asked about. With a cleanser, I'm less particular. I think that if you have sensitive skin, you may want something more lightweight, like a less harsh foaming, exfoliating cleanser, maybe a lighter weight cream cleanser, or something that's hypoallergenic, for example. For someone who's got more acne-prone skin, they can maybe tolerate something that's a little bit so-called harsher with glycolic or salicylic acid or something like that. So you usually start with cleanser, and we typically recommend morning and night if you wear makeup, but often people over cleanse, and so I don't, it's a big thing in dermatology. People want to scrub their skin, or if they have acne, they over cleanse, and that can irritate the skin. So keep it simple from a cleanser perspective. So boiling it down to things that have evidence, because that's what I care about. I mean, there's so many things that people are like, oh, it's going to take away my wrinkles, or they bring in these products. I'm like, I have no idea, just as they do. And lots of things look pretty, but they don't necessarily make you pretty. So things that have evidence, vitamin C containing serums, and everyone is like, oh, vitamin C, take it by mouth. Sure, you can, but specifically applied topically. Not all vitamin C containing serums are created equal. You have to have the right pH, and there's some that have more evidence. But certainly vitamin C applied topically can be useful overall as an antioxidant. It can help give your skin a little glow. It has some evidence around anti-aging. And so that's something we typically apply in the morning.
Okay.
And then in terms of evening, we often recommend a retinol, vitamin A, or tretinoin is the different names for it. And that, again, has similar evidence around anti-aging, reducing fine lines, wrinkles, helping reduce pigmentation. So it's got a number of really good and useful features.
Sure.
Yeah, so those 2 things, I think, in addition to, of course, sunscreen, which we have previously discussed, but certainly sunscreen is absolutely important as well.
And now in terms of retinol, sometimes people are a little bit apprehensive to start it because of potential side effects or sensitivity of the skin. How often do people encounter that, and how can they sort of prevent?
Right. And so, retinol, again, I think it depends on the dose that you're using. There's lower doses, and you can certainly talk to your dermatologist or physician who prescribes it for you about what dose to start off with. But typically when you do start a retinol or one of these vitamin A containing products, I do tell people you're probably going to be red and dry in the beginning.
I see.
And that's a normal feature until you build up almost sort of a resistance or tolerance to the medication. So people who are very sensitive, I'll say apply it once every few days to start, maybe even once a week if that's all you can tolerate it, and slowly work your way up until you're applying it daily.
Daily, I see.
Yeah.
And now what about oils? Sometimes, people with dry skin, they love using oils and coconut oil or just different types. Is there the oil to use, or is that ever contraindicated? Is that something you recommend?
Yeah, I mean, oils, again, have become very hot in the press about things that you can use, and coconut oil being one of them. I think an oil or an emollient or a moisturizer in general is fine, and if you need it, it's great, especially maybe if you're dry or irritated from your vitamin A product, that will be helpful to mix in and provide relief from that. When I don't recommend it is someone who's very acne prone, especially for something that's quite occlusive if they're putting on something too heavy. But aside from that, if the skin loves it and they feel hydrated, great, go for it. It doesn't provide a lot of active treatment in terms of reducing lines or things like that, but it certainly makes the skin feel good.
And what about one more thing that I often hear about are these algae products. Is there any evidence of
Algae products, not that I am aware of in terms of high level evidence. Now,
Sure.
having said that, there are new products that are going on the market all the time.
Sure.
And so, you never know, but I'd need to see a little bit more on that one. Certainly when you're applying things, everyone's like, how do I do it? Like, which one goes on first?
Sure.
Usually I recommend that patients put on the lighter weight serums first. So for example, vitamin C. If you use a moisturizer, you can put it on next. And then I typically recommend the sunscreen goes on last to provide that barrier over top and make sure you get a good layer overall. And then in the evening, you can put the retinol on first. You can even, some people to help with the irritation can mix it in with the moisturizer or put a moisturizer on immediately after. And then whatever other products you can layer on in between.
Yeah.
But certainly don't let the complexity of products deter you from trying them, because it can be helpful for your skin.
Great. Well, thank you so much. Thank you for joining us, and thank you for watching. And if you have any questions or comments, feel free to let us know.